You are the nurse taking care of a 19-year-old patient at a primary care clinic who complains of fever, tonsillar exudates, tender anterior cervical lymph nodes, and a sore throat without a cough. How many of the center criteria for streptococcal pharyngitis does this patient exhibit? A. 4. B. 1. C. 3. D. 2. E. None of these. The answer is A. 4. The patient exhibits 4 out of the 4 center criteria for streptococcal pharyngitis. The center criteria are as follows: 1. Tonsillar exudates. 2. Lack of cough. 3. Fever. 4. Tender anterior cervical lymphadenopathy. The center criteria are used to generate a score based upon the patient's age and number of positive criteria. This score can then be used to assess the likelihood that the patient's condition is due to streptococcal pharyngitis, and therefore to guide the decision of whether or not to treat with antibiotics for streptococcal pharyngitis. In this patient's case, since they are older than 14 and younger than 45, they do not gain nor lose points for their age. They get 4 points total for having all of the positive criteria. Therefore, it is highly likely that they are infected with streptococcal pharyngitis and should be treated empirically with antibiotics. The pediatric nurse is counseling a mother-baby couplet who are having trouble breastfeeding. The baby is showing poor suck and falling asleep at the breast. Which of the following is not an appropriate intervention? A. Play with the feet of the newborn while feeding. B. Feed the infant according to infant's cues. C. Feed the baby every 3 hours until they become in sync with the pattern. D. Unswaddle and undress the baby prior to placing at breast. E. Gently caress or rub the head of the infant. The answer is C. Feed the baby every 3 hours until they become in sync with the pattern. When presented with an infant showing poor suck, it is important to feed when cues are given. The infant will suck best when hungry. However, a breastfed infant should not go more than 3 hours between routine feedings in order to establish healthy weight gain. Feeding every 3 hours regardless of cue is less advisable. Unswaddling, undressing, and stimulating the infant can sometimes aid in keeping them awake and sucking well at the breast. Individuals who contracted varicella zoster, chickenpox, in childhood may experience which of the following if the virus is reactivated later in life? A. Scarlet fever. B. Rheumatic fever. C. Orchitis. D. Shingles. The answer is D. Shingles. A common sequela of varicella is shingles, a painful rash caused by reactivation of the varicella zoster virus along the single dermatome that corresponds with the site of initial infection. Rheumatic fever and scarlet fever are both possible sequelae of streptococcus infection, and orchitis is a potential sequela or comorbidity of infection with the mumps virus. At what point is a child with varicella no longer contagious? A. By the time the lesions are visible, the child is no longer contagious. B. After the last lesion has broken open and crusted over. C. 7 days after the initial presentation. D. After the last lesion is no longer visible. The answer is D. After the last lesion has broken open and crusted over. Varicella is a highly contagious infectious disease of childhood. It is no longer contagious when the last lesion has broken open and crusted over. Until then, the virus can be spread via respiratory droplets, by contact with the saliva of an infected child, or by touching an unbroken blister or the fluid within a blister. What is the most common cause of renal failure in the United States? A. Renal cell carcinoma. B. Polycystic kidney disease. C. Drug overdose. D. Diabetes mellitus. The answer is D. Diabetes mellitus. The most common cause of renal failure in the U.S. is diabetic nephropathy due to diabetes mellitus. Diabetic nephropathy can include multiple complications including arterial sclerosis, glomerulosclerosis, pyelonephritis and renal failure.